All right, welcome everyone to another episode of the LLD Conversations. I'm your host for today, David Brackett, and it's a real honor to be here with Richard Laraya, who's joining us all the way from Arkansas today to share a little bit about his journey and his story with language barriers, language access, and some of the challenges and successes that he's had in our language industry. I'm going to do a quick intro, and then we'll go ahead and get started and learn today from Richard. Richard is currently a community health worker, and he's joined the Marshallese Educational Initiative, the MEI, back in 2018. He's had many roles at that particular nonprofit. He's a community health worker and the director of media. Richard has led MEI's digital outreach efforts during the pandemic, and through videos and social media, he played a significant role in educating the community about COVID-19 prevention efforts and the importance of vaccination. He also is a certified car seat technician who ensures that car seats are properly installed. Richard participates in direct outreach with the MEI outreach team and has traveled throughout the state of Arkansas and other states with the outreach team that have larger Marshallese populations. Richard is passionate about serving his Marshallese community and helping Marshallese families in need. He completed a fatherhood fire program and advocates for the importance of male role models for youth. He is married and has 2 children. He was born on Mahuru Atoll. His ultimate goal is to inspire others by showing them and lending them a helping hand and how to make a huge difference in someone's life by building confidence in our problem-solving abilities and making the world a better place all together. So without further ado, Richard, thank you so much for being with us here today.
Awesome. Thank you so much, David Brackett, for introducing who I am to many of those that might don't know me. Again, my name is Richard Laraya, born and raised in the Marshall Island on the capital city, Majuro. And I was adopted back on the island. Currently residing in Arkansas now.
Okay. Richard, can you give a little bit of a story for us about your journey to the United States? Yes. back in 2013? What inspired that transition, and what was that transition like for you and your family?
Okay, so my journey, my family's journey, back in the island, I had the opportunities to work and have education, but ever since I had my 2 kids, that really painted a picture where I see my future and my children's future, which is bringing them to the United States to have better education and better healthcare. In the Marshall Island, the education system is based out of the U.S. And is I feel like moving to the United States back in 2013 really opened up my eyes. It really spread out my wings for many opportunities as well. And moving here to the United States, was quite challenging for both me and my wife as we, started meeting families, getting to know folks, adapting to the American culture. It was challenging. It was difficult for us. Even like going to McDonald's, we can't even order what food we want to eat. Because we were still learning the language. We were adapting to so many things during our journey. And then the one thing that really brought us here is for better healthcare, and that's one thing that I really was really open to looking forward to. It is job opportunity, better healthcare, and education. And those are the 3 main cores that I remind my family each and every day, why we're here in the United States.
Yeah. And when you arrived here and being confronted with that immediate language barrier, what were the what was the experience like for you as far as was interpretation provided? Was document translation provided? How did you maneuver through that situation?
Yes. So moving here, as I mentioned, it was really quite challenging, especially with translated materials, interpreter provided. I felt like in the past, I signed my life away for so many documents that I didn't understand, especially in the healthcare area. That one day, that one moment when our daughter was really ill, um, and we didn't even have a right at that time. So gladly, our neighbor, were able to provide transportation. I didn't know who to call. I didn't know what hospital, to take my daughter into. Um, the you know when my wife and daughter and the neighbor got to the hospital, they gave me a call back, and there was no interpreter provided at that time. Um, so it was really hard. It was really hard for us to really understand what was going on with our daughter, and that communication between my wife, the nurses, and the doctor. It was quite challenging because we didn't even know any medical terms, what tools were being provided at the healthcare. So it was one of those moments, where it really, shocked me. And then, looking back at that time, I remember, me telling myself that, from this day, there's got to be something I need to do, to give back to the community. Is, imagining everyone else coming to the United States with limited, with language, barrier, could probably go through the same
Mhm.
situation that my family went through. Which, I'm glad that I really took times to really saw uh, what my family went through in the past, and then really pursue that barriers to this day. Because during the COVID-19, that
Yeah.
really proves that it's serious to. It's really important to provide language access to those that need interpreter.
Yeah, no, it's huge, and I think in one of the videos that I watched about you that you shared was that you, in your language, in Marshallese, in your native language, there isn't even a direct translation for the word. Was it healthcare or?
Yeah, so I'm glad that you brought that up. So it's the healthcare system. So within our language, Marshallese language, so we borrowed some words. Some are from German, some are from American, some are from Japanese. So we don't really have a lot of terms to interpret or translate. For example, like healthcare system, we don't have any terms for that, or definition for it.
So, and then just one more thing, just for a lot of people that might be listening in today might not necessarily know about the history of the Marshall Islands and what caused some of the migration to the U.S. was the from the during the 50s and the 60s, some of the nuclear testing that the U.S. was doing, which caused a significant amount of radiation in the area without proper warning or preparation to the people of the Marshallese Islands, and with a lot of promises were made and under delivered as far as that goes. And so that's one of the reasons why that the Marshallese community today are allowed to come into the United States. However, there's been a lot of just overall deception there with that really tragic situation. Did you want to talk a little bit about that?
Yes. So there is an agreement between the United States and the Marshall Island. after the nuclear testing were conducted back in the island. Then this agreement is called COFA, COFA, which stands for Compact of the Free Associations. So that is the agreement that the United States allow us Marshalls to move here to the United States without any visa, just our passport, to come here to the United States for education, job opportunities, and healthcare. Um, and then, before the compact was signed, when the United States conducted the 67 nuclear tests, our people were informed that there's going to be a testing for a nuclear test, and then they informed our people that they'll be relocated to a different island, and then with not enough information being provided when the nuclear testing was conducted, especially with the Castle Bravo. That's the one that was that's the one that was 1,000 times stronger than the bomb that was dropped in Hiroshima and uh, Hiroshima and Nagasaki in Japan. So when they did that, when they conducted the Bravo test, there were white stuff coming out of the sky, and people were thinking it's some sort of snow. They didn't know what these were that were falling from the skies, and then all of a sudden they started their skin started peeling off, their hair started falling off, and then people started getting really sick after that. Um, and then a woman also gave birth to jellyfish babies. So it was a really a tragic moment for the Marshalls back in those days. And then after that, after the aftermath, that was when the agreement was signed. For Marshalls to come here, for better health care. But other than that, I feel like not everyone back in those days really understand the whole scenario of what was going on. And that's how we Marshalls are allowed to come here to the United States. It's because of that Compact of Free Associations.
And then now with you, what was your motivation for getting involved with the MEI, the Marshallese Educational Initiative?
So back in 2015, that's when we moved from Hawaii to Atlanta and then to Arkansas. I started off getting a job at the chicken poultry, as a production line worker. And then, that's when I first saw that there was a need of an interpreter needed. Because, I've seen a lot of my colleagues and families and friends, they were being treated unfairly in the poultry industry. Not just that, but, when if someone is sick, they can't call, or they can't, explain the situation why, they're not coming to work, or something has happened in the production line at that time. And then after I was, after those years of work in the poultry industry, I moved, and then I become a leasing agent, for apartments. And then that's another area that I saw a lot of my community member being evicted, is because the lease wasn't translated. The apartment manager didn't hire an interpreter, but a lot of my community member, signed that lease agreement.
Right.
They're agreeing to everything that is being stated on the lease. So me seeing that opportunity really, bothers me a lot. especially when I went through the same thing with my own life and with my family. And and then every time I would, help families or my community out, the most thing that I hear is language barrier is the common issue. And me hearing this all the time, instead of me waiting for that to happen, that's
Hmm.
when I started, taking that role. And then today, as I, work with the Marshall Ridge Education Initiative, I take on that role as a interpreter. We provide trainings for interpreters to, uh, become more confident and then to spread out more resources about what we do as an interpreter. And I feel like, within the couple of years, we've changed so many Marshallese interpreters that, are very well um, aware of, how the interpreter process, is. And, I feel like, um, that barrier is slowly, fading out because of providing these training. But in the past, we didn't even there was any resources provided or any trainings available.
And for the MEI, is that something that is based out of Arkansas, or is it remote?
So MEI, the Marshall Leeds Educational Initiative, we are based in Springdale, Arkansas. It's been MEI has been established since 2013. So I got hired on back in 2018. So it was already a year before I
Mhm.
got hired on to the organizations.
And for other interpreters that might be interested, other potential Marshallese interpreters, would they be able to be involved by also joining remotely, or is it all on site based?
So it's both. It's on site. We are partnering with the University of Arkansas. We do have that. We do have that partnership with the University of Arkansas with our Marshallese. It's called MICI, Marshallese Interpreter for Community Inclusion.
Okay.
If I do remember it correctly. So, that's the partnership with the University of Arkansas with MEI. So we do provide that in person, and then we are also partnership with ABICE, is Arkansas Bilingual for Arkansas Bilingual Credential Education. And
Okay.
that's we do provide that not in person, sometime in person, but we do provide that for folks out of state as well.
Okay. And how do you envision MEI growing over the next couple of years?
Um, so the way I envision MEI in the couple years from now, I feel like we have come, we have came so far that a lot of our community members and non-Marshallese as well, really understand, the core mission of what we do, providing um, information, educational information for non-Marshallese and also educate the Marshallese about both culture. Um, and the way I envision it is we are slowly expanding. You
Hmm.
know, um, we recently just opened up another MEI office in the Marshall Island. So that's a big accomplishment for
Wow,
this year.
excellent.
And
It's great.
I feel like the team is they've been doing an outstanding job of doing what they're supposed to do, especially with you know being loyal to our main core, which is providing that education and more trainings um, and educate the community about the nuclear testing and pretty much the health barriers that
Mhm.
and language barrier that we are experiencing today.
And how do you currently see the need for more Marshallese interpreters in the U.S.? How large of a gap is there?
Oh, that's a good question. So in the past couple months and years, a lot of my community members from out of state, have been, contacting us, how can you guys bring that training, or will it be available online for us to, take those training? So before that, we did it in person, just to see, how can we expand it more? And then we started, getting a lot of questions about, able to provide this training online. And then, which we did, and then, we started seeing a lot of people wanting to participate in the interpreter training. And then, so for these trainings, we started out basic, which is, make sure that interpreters know what is the interpreter role is.
Right.
And then from that, we move on to the next, which is connecting them, to become certified. And then after that, they can now able to interpret for their states or, for their community. So I feel like we are the gap between before and now. I feel like, we're slowly getting there, but also more and more interpreters, Marshallese interpreter, are becoming more confident in interpreting, and then they're really wanting to able to be certified and enabled to help out their Marshallese community throughout the state.
Fantastic, the work that you're doing, Richard. What would be a message that you would have for, let's say, individuals that might be interested in becoming an interpreter? What sort of message of inspiration would you have for them as far as the impact on the service of interpretation?
So what I would inspire others that want to become an interpreter or wanting to is excuse me. So I would inspire others by don't wait till something happened. I've been there, done that. I had to find a ways to bridge that gap. So I inspire those of you that find resources available. We're here. If you guys always need help, we can find resources for you guys as well. But don't wait. Be confident. Interpreter is not easy. We have limited words in our language, in our spoken language, even in translation. Be confident. Just be you. Connect with those that are willing to help you through your path. If you don't know what you're doing, those people will help you. Because I've been through there. I've been there, done that. Now I'm actually really bringing a lot of our community members, and then not just the Marshallese communities, but there are other communities that I also bring in to work together as one in this interpreter area. So I really inspire those that do your best and just be confident. Just be confident. That's all it matters. Be confident.
Great words of inspiration there, Richard. And the need is there. The opportunities are out there. So for those who might be listening today and want to get involved, talk to someone. You can reach out to the MEI organization as well for questions or for next steps as to where and how does one even get started. They're available to help guide you wherever you might be located and wherever you're at on your interpreter journey. Richard, thank you so much for taking the time here today to be with us and share a little bit about your family history, cultural history, as well as just your journey coming to the U.S. and the language barriers and the resilience that you have shown, your family has shown, to be able to persevere through that and now create new opportunities and remove that language barrier so that individuals who can participate in their healthcare and have other opportunities that many have not had. So I applaud you in what you're doing, and we are here at the NCIHC to continue to cheer you on and collaborate and partner with you however we can.
Awesome. Thank you, David.
Thank you, Richard.